Content warning. This podcast episode contains discussions of a sensitive nature that may be triggering for some individuals.
5, 4, 3, 2, 1. Let's go. Diary of a Kidney Warrior podcast in partnership with Kidney Care UK, sharing faith, knowledge, hope, and love.
Hi, and welcome to Diary of a Kidney Warrior podcast. My name is Dee Moore, and I am a kidney warrior. This podcast is dedicated to encourage, educate, and inspire as we explore all aspects of kidney disease, related chronic illnesses, and health. In today's episode, I am bringing you a kidney warrior story. Now, there's always something you can learn from someone's story, something that can bring inspiration and hope. Today, I'm joined by the incredible Lois from Paisley, Scotland. Lois's journey with chronic kidney disease took a remarkable turn when she received a life-saving kidney transplant from a friend. Her story is filled with courage, faith, and the strength of community that carried her through some of her most difficult moments. It's truly a moving conversation, full of honesty, inspiration, and hope. Let's begin. Hi, and welcome to Diary of a Kidney Warrior podcast. How are you doing today, Lois?
I'm good, thank you, Dee. How are you?
I'm good. I'm really, really good. I'm really excited about our interview today. And everyone knows what I'm going to say because I say it every single time, but I do mean it when I say that I love recording Kidney Warrior story interviews because, as I say every time, it's so powerful to learn from someone's lived experience of CKD, someone who's been there, done that, and worn the t-shirt. So I'm really excited to interview you today.
Thank you for having me. I'm excited to share my story.
Without further ado, I'm going to ask my first question. And my first question is, how did your Kidney Warrior journey begin and how were you diagnosed?
So my kidney journey began when I was 7 years old. I'm 52 now, so that's a wee while ago. And I found out that I had Polycystic Kidney Disease because my dad was diagnosed with it. And from there, they did subsequent tests to check my sister and myself, and we both had it. And that's where it all began for me. I was diagnosed on the back of his diagnosis and being checked then.
So from a very, very young age, you knew that you had this condition. And so did it make any immediate difference to your life? Did you have to do things differently or were things the same?
In the immediate at that age, there wasn't any huge differences. It was a case of going annually and having a checkup at the hospital, having a scan, having some bloods. But I think that probably started when I was about 12. So there was probably a little bit of a gap. And then from there, it was annual checks.
So growing up through your childhood, adolescence, adulthood, everything the same, just living life as normal? Or as you became older, did you become aware that you had to make changes? How was life with the condition?
Sure. So from being diagnosed and then through my childhood, I would say there wasn't really any great difference. For then my teenage years, I was very aware of being careful to look after my kidneys, of predominantly just not getting them bashed, if I'm honest, of being quite protective over them physically. And I would say then, you think, goodness, teenage years become adulthood before you know it. You think as a teenager, you've got this great big span of time. But before I knew it, I was into my 20s. And I would say then was probably, again, going for annual checkups, but being aware that it was something that might impact me in the future. During my teenage years, my dad, he passed away, not directly from kidney disease as such, but from high blood pressure caused by his kidneys. So the kind of teenage years were a little bit difficult, and the early 20s had challenges of their own that then kind of emotionally linked into the fact that we all had CKD.
So when did your kidney function begin to change?
So in October 2020, I had been unwell with what I thought was a tummy bug. I had taken to bed for a few days and wasn't clearing it. And then it was kind of thought that the chances were it was probably urinary tract or kidney infection of some sort. So given that we were kind of tail end of COVID, I didn't see my GP. They knew me well enough to give me antibiotics, which I had, and nothing changed. And then I had another course of antibiotics, a stronger one. And at that point, they said, pop in, we'll do some bloods. It's been a couple of years since we did your bloods. And at that point, we found out that my kidney function was, my eGFR was at 10. I hadn't been for about 4 years to appointments, my annual checks. I was fairly newly married, and I dropped off the radar for a few years when that had happened in my 20s. And then subsequently, as I was older then, I had been probably about 4 years prior to this, and my function was about 42 from memory. It's about 42. And we kind of, it was keep an eye on it, lose some weight, all of these things that I was doing at that point, but no idea that it was possible for my function to drop so dramatically in that time.
So in a 4-year period, you went from about 42% eGFR to 10% eGFR. I mean, that is a significant drop in such a short space of time. Did you have any symptoms at all?
No. I was tired. Life was very, very busy at the time. And I put it down just to probably doing a little bit too much work-wise alongside my husband in different areas. And I put it down to that and just getting a little bit older, but I didn't have symptoms that you would expect at that level of function. I think what they've now said is my body kicked into overdrive to compensate because it was gradual as much as it was over a 4-year period or thereabouts. It was still fairly gradual. And my body had adapted to the fact that it just lived without kidney function. It just kept functioning without any symptoms at all.
I mean, that really goes to show that, when people say, why are you talking about kidney disease so much? I feel fine. It really goes to show that you won't necessarily get symptoms that you'll associate with kidney disease. So this is why it's so important to get yourself checked out, go to your appointments, get your blood tests, get your urine tests to make sure. So hearing this sudden news, how did you feel? Like, what was going through your mind at that time?
It was horrendous. I had a phone call from my GP the same day, just after 5 o'clock. I was working from home. My husband was at a meeting, and my GP said, your kidney function is seriously concerning. I need to find a bed for you. We have to admit you straight away. Can you pack a bag? And, he could hear in my voice, there was no tears. It was just shock. And he actually, bless him, he told me what to pack. He was like, these are the things you need. You could be in a couple of days. And he said, can you get to the hospital or do you need an ambulance? I said, no, I'll get there. And I phoned my husband and said, you need to come home. I've got to go to hospital. And I packed up some things, and the nearest hospital he could find was 20 minutes in the wrong direction from where we live. And off we went. We got there, my husband thinking he'll be able to take me in. And I presented at A&E, which is what I was told to do. And of course, he wasn't allowed anywhere near me. He had to drop me at the door with my bag in hand and leave me. And for me, that was awful. But like a lot of what I'll share with you today, Dee, I coped with what I needed to cope with. But my awareness was always on the other people. Not that it wasn't on myself, because of course it was on me. But even in that moment, my concern was my husband's having to find all of this out via text and phone calls. He's not there, and nor was he for any of the appointments in the run-up to things changing for me. But if you met my husband, this would not be a surprise. And anybody listening to this that knows Craig, it's no surprise he tried to sneak in twice and got caught twice trying to sneak in and was chased. But he sat in the car till about 11 o'clock that night in the hope that either I would be coming home or that he would be able to get in and be with me. So the journey of that was really quite difficult because of the times we were in and not being able to have any support physically with me. But yeah, the fright was just horrendous. I was then in a shared ward in a hospital, 7 months, 8 months into COVID times, very aware of keeping myself safe and wanting to go home, but also very aware of the embarrassment of trying to explain why I hadn't been for a few years. There was no judgment from anybody other than me, But I felt very, very bad about that. And to this day, to an extent, I still regret not keeping on the radar. But it is what it is. I can't change the past.
I always think that we can't change the past, but we can certainly change the future, and we can certainly make the difference for other people. So in saying that, what advice do you have to somebody listening? Because what we can do is, from your learned and lived experience, show someone else the importance of attending appointments. What advice do you have to somebody who kind of misses a few here and there, or has decided, I'm okay, I'm stable, I don't need to go? What advice do you have for them?
Learn from my mistake. It was foolish. It was not deliberate. I would never be neglectful, but learn from my mistake. If there's an inkling in you to think, I can skip an appointment or I don't need to go, it's not worth it, because the regret that I felt was horrible. And I also agree, you can't change the past, but you can move your future forward. You live by your mistakes and you learn from them. And it was a mistake. It was a foolish mistake. It wasn't a deliberate one. And in reality, the outcome would still have been the same. But perhaps for those around me, if not only for me, it wouldn't have had the same trauma to it. Because we went from living what we thought was a fairly normal life to being thrown into a world of terminology and potential that we didn't have a clue about. You know, of course, from having polycystic kidneys as a child and a teenager and a young adult, I was aware that time would come. But probably with a bit of a naivety of, that might never happen to me. And if it does, we'll deal with it. So learn from my mistakes. That's what I would say.
So how long were you in hospital for?
I was in for 2 nights, and the initial hope was that it was acute kidney injury and that they would come back. And at one point, I think the night I was admitted, my function on the blood test has dropped to 9. And then the next morning it came back up to 10. And, you know, the 2 days that I was in, it was very little done. It was a case of saline drips to see if it was just simply that I'd been dehydrated, all the usual things. And I was seen by the renal team at the hospital that I was in. But it was a case of, you know, this is looking like it is a natural deterioration. And then, of course, the promise of being followed up at the renal clinic. And they let me go after 2 nights in hospital. One of the nights I was moved in the middle of the night because there was COVID all over the ward. And that was awful. There was a lady in with me at the time who was very fearful, and a lovely lady who was very religious, and she insisted the 4 ladies in the room had prayer before night time, so we let her do that. You know, we were just all like, what's happening to us? But that was a really precious moment as well, this older lady having a moment for us. But yeah, so after 2 nights, I was let home.
So at this point, they were still thinking it could be acute kidney injury, AKI. At what point did they realise that, no, this was a decline of your kidney function?
There was still that hope, I think, for them, but there was also the desire of getting me out of hospital, because if it was, my kidneys were packing in, they didn't want to keep me in a hospital. So there was still a hope that it might be the case, but they'd discharged me from hospital on the understanding that I went straight back to outpatients clinic 3 days later. So I was sent home from hospital on the Friday and back to clinic on the Tuesday. And then from there, subsequently, when nothing got any better and my creatinine was really, really high, when I was admitted to hospital, it was at 502. It got higher than that, which you'll hear about in a few moments, no doubt. But it was at 502 at that point, and then they realised actually it is deterioration, and I was then treated at low clearance clinic from there, and I never missed an appointment. Just to put that in there, ever again.
Every hospital and country is different. Where I'm from, the threshold is 10% when they start dialysis. So just leading up to that is when you start having that discussion. So at 10%, were they starting to now talk to you about dialysis and transplantation options, or were they still hoping that through the low clearance clinic that things would improve?
In the very short term, there was the hope that things were going to improve, but I was being seen every week. And I would say within a fortnight of being at low clearance clinic, it was already discussed about dialysis, transplantation, the options of dialysis. All of that was discussed. But what they'd said was, as much as there is a threshold, I don't know that where I am, that there is an exact number. It is very symptom-led and blood results-led. But I was aware that I was hitting it, which, wherever you were in the country, let alone here, in Scotland, it was very much, you're dodging a bullet at the moment not to be on. But the team that I had were just incredible and continued to be throughout my whole journey of seeing me as a person and not just being, well, this is how it is, this is what we need to do. And I think for me, if it had been as straightforward as that, the reality was I didn't need dialysis at that point. My body was managing. My other blood results were great. There wasn't any concerns with anything else. There wasn't any concerns, I wasn't retaining fluid. I was still producing urine. All of those things that they go by were all okay. It was just that my kidneys had decided that they'd given up on living, and they were slowly coming to an end of life earlier than I wished that they would. But hey, that's what they were doing. So the conversations over dialysis, transplantation, have you got a pal who wants to give you a kidney? All of those things were taking place. And I also had, and I'm very grateful, we had a home visit, which was the only opportunity in the early days that my husband had to talk to anybody. We had a renal specialist nurse come out to see us and go over all what that could look like, how it could look. And of course, she left her beautiful living donor pack, as they do, on the side of the settee when she left.
So what modality of dialysis did you choose?
I had no option other than hemodialysis because I had a large umbilical hernia. So peritoneal wasn't an option. And they'd put me forward for training to see if we could be assessed and approved for home hemodialysis with my husband being trained up. That was all discussed before the Christmas of 2020. And then the January of 21, I had an appointment to see about having a fistula made ready for dialysis. And then that period of time up till the Easter of 21, we'd been approved for home hemodialysis when the time came.
Did you start the training of home hemo, learning how to needle yourself, things like that?
So I wasn't trained up for dialysis because I didn't get to the point of needing it. In the period of the first 6 months, I think I dropped about 2%. I think we floated between kind of 8 and 9 eGFR, varying at different points in that. But we'd had a meeting to see about having a fistula created. We'd met with a home hemodialysis team and been approved for that. But I didn't get to the point that I needed dialysis, which is somewhat remarkable because I actually, just before I had a transplant, so firstly to mention that, just before I was transplanted, I reached an all-time low of 3 with a creatinine of 1,495 at that point.
Wow. You really were a walking, talking miracle at that time to have such a high creatinine level and still be able to function and not be on dialysis. That is, wow. That is incredible, truly incredible.
It is.
Wow.
And it's quite something. And you just use the word miracle there. I am a walking miracle. I'm transplanted now, but I'm a walking miracle because I am not against dialysis. I'm not against anything. You have to have what you need to have. And I would have had dialysis in a heartbeat. But for me, the way my journey went was just that the team that were looking after me said I would not feel a benefit from dialysis because my body was managing. And they closely monitored me. They did things over and above to make sure that they were keeping me safe. But it's quite something to think I was functioning with those levels.
So you mentioned that you went on to have a kidney transplant. How did that come about?
I mentioned there that the renal nurse had left her lovely pack about living donor and having the conversations with your loved ones about would somebody like to give you a kidney. And I heard it all and I listened to it all, but it just wasn't for me to have those conversations. What my husband and I, we're Christians. We have a faith in the Lord Jesus. And to put in there at this point that whilst I have that faith, I see it as I have a hope that anything that happens to me is in his hands. And I'm not in control of that, but I trust that he will look after me, whatever the outcome. But just to put in there my disclaimer, it does not make you immune to kidney disease. It doesn't make you immune to all of that and all that that entails. But we trusted that whatever way this was going to work out, it would work out okay. And nothing would happen to me that wasn't in a bigger plan. And that was our hope. And that was what saw us through the difficult times. So, as soon as people were saying what's happening with Lois, what's happening with you, we just basically put it out there saying either my kidneys need to restore incredibly and miraculously and come back to a normal human being's functioning level, which it wasn't, or I would need a transplant. And we would just say, to be fair, mostly people were asking my husband rather than asking me. They would say, what's happening with Lois? What are they doing? And he would just say, well, Lois will need to have a kidney either by a deceased or a living donor. And people would say, what's a living donor? And he would explain that it's when somebody wants to give you one of their kidneys. And we just left it at that. My husband did try to be a living donor, but he went through his testing and got to the point where his kidney function was just slightly lower than it needs to be, because it needs to be incredibly good to give one away for obvious reasons. They're not going to leave a living donor at risk. So that happened. And then a couple of other people had come forward to see about doing it, but weren't suitable. And then I had another friend, Andy, who went through all of the tests to be a living donor. And he wasn't a match, but we were approved for transplant through the kidney sharing scheme, the living donor sharing scheme. So those things kind of were happening in the background. Meanwhile, my kidneys were deteriorating month on month. And we were very much aware that we were going to come to the point where dialysis probably was going to be needed. Andy and I were in the sharing scheme from the January of 2022. And again, his test went really well, really quickly. And then in the July of 22, Josh, who was a friend from church, Andy was also a friend from church at the time, Josh came along and said that he had known about my deterioration, had obviously been part of our world and seen that happening, and wanted to see about being tested, which he did, and found out very early on we were blood group matched. And then within a matter of a couple of weeks, we were also tissue type match. And he went on the journey then to give me one of his kidneys, which he did in January 23.
That is so amazing that so many people were willing to give you that gift of life, that second chance at life. And, I just want to acknowledge all the living donors out there. I call them superheroes that are willing to give something so precious. So I just want to give acknowledgement and a shout out to all living donors. So tell me about the operation, the process of receiving that kidney.
So we had some appointments together. So the process was Josh had all of his appointments. He would then just tell me what was happening, which was incredible. He was doing phenomenally through all of his tests, to the point that when he was reaching the final kind of kidney function test, they had said to him he had superhuman kidney function, that it was so good that they couldn't even put measurements on it, which was amazing. And then we went to a joint appointment to see surgeons, where that was the final meeting that we had, where the two surgeons separately, one for me and one for Josh, had approved us for transplant and for me to have Josh's kidney directly. So that was December 22, not long before Christmas. And we were originally due to have our surgery beginning to mid-February, but at that point, I was at 4% function. And then the week after we were approved for transplant, I dropped to 3. So on the 30th of December 22, Josh had the phone call first, because it's his kidney, it's his choice, to say that they had got us a date for the 17th of January 23. And then while I was on the phone to the transplant coordinator, Josh was phoning my husband Craig to say, look, I've just had the call. And then we obviously had a call together. And we were transplanted on the 17th of January. So surgery, goodness. I went in the day before, Josh went in the morning, and he had a surgery for them to take his kidney, his left kidney, to give it to my right-hand side. And he came through that fine. Everything went smoothly. And then they came to get me, and off I went down to theatre. I've never had a surgery in my life. I've never been under an anaesthetic. And again, just the level of care and understanding and support from the team was and has been just phenomenal. I had my transplant. I woke up very sharp, very bright as a button, which is kind of my personality, to be fair. I'm quite bright and sharp as a button most of the time, except when I had chronic kidney disease and failing kidneys, and I was a mess. But now I woke up very sharp, very well, and the kidney was working straight away. It started working when they popped it in there. My creatinine, while I was still on the table, the morning of my transplant, it was 1,495 the morning of transplant. And while I was on the table, it had come down to 1,200 odd straight away. By the evening of my transplant, so less than kind of 10 hours, I think it was midnight, my blood showed that I was at 899. Following morning, I was at 502. And that night I was at 399. And then from there, it was in the hundreds. And by the time I came home, I was sitting about 90 for my creatinine, which I probably hadn't had a creatinine of 90 since I was a child, to be honest. I don't know. But it was just absolutely incredible. Josh did amazingly. He was, very, very sore, understandably. But he was walking the next day. We've got the most beautiful photo of us when he popped into my room the next day to have a picture together, and we're both in our gowns. And you can see, all over his face that he's in pain, but he's walking, and we had some really precious moments. Josh has a beautiful wife, Erica, and two lovely children. And at the time, they just had one wee boy, Ethan. So Erica, Josh's wife, and Ethan would pop in every day when they were coming to see Josh. They would stand at my door to say hello. And precious, precious times. The relationship between all of us is something that you just can't explain that now. It's so close.
That really is beautiful. That is so wonderful to hear. And what difference has receiving that kidney made to your life?
Completely changed it. From the moment I woke up from surgery, it was like somebody turned the lights back on in my brain. And you don't know what you don't know. It's one of my favourite sayings. I'll say it often at work. I don't know what I don't know. But you don't know at the time, when you've got so used to surviving and keeping going. You don't realise just how bad it is until it's better. And it's just got better and better since that moment. I'm doing things now that Josh was 29 when he gave me his kidney, and I was 50. And I definitely got his youthfulness with it. Craig says that he can't keep up with me. I live life really well. We have beautiful holidays. I'm awake, I'm bright, I'm functioning. And I'm doing all the things that Josh hoped I would when he decided to give me part of him. And what a gift, what a guy, what a couple. It's all very well, appreciating what Josh did, but there would be no kidney giveaway if it hadn't been for a wife that agreed. And at the time his wife was 26. As a 26-year-old me, I don't know that I would have done it. I don't care how old the other woman is. It's still another woman that you're giving to, but she was 100% in. And they are just such a special couple. It's completely changed my life. There was times I was going to church. We know each other from church, and there was towards the very end, once we knew that Josh was trying to give me a kidney, there was one Sunday that I got up and it was, will I go, will I not? And I was like, no, I can go back to bed after. And I kind of went in the comfiest clothes I could find that weren't actually pajamas, but looked like it. And it was a Mickey Mouse t-shirt that a friend had given me, which I loved. But it was like the comfiest things I could find. And somebody actually said to me at church, well, are you wearing your pajamas? I was like, actually, I'd made every effort to get dressed. But when you're on a kidney journey, anybody listening to this, you folks will know that what people see and what's happening are two different things. What people see now is somebody who's awake and alive and living life and so blessed. But the journey can be hard.
So from your lived experience with CKD, everything that you've learned from your childhood through to adulthood, through to transplantation, what would you like to share with people out there, kidney warriors out there, friends, family, people with an interest of kidney disease? What would you like to share with them?
So the first thing I'd say is make sure and get checked. You know, if you've got any inkling at all, or you're reaching a certain age, or if you've got any history at all of anything that could cause harm to your kidneys, make sure and get checked regularly. Then I would say, I think for me, I kept on going and kept on going. I worked 4 days a week, full-time days, right up until the Friday before my transplant. And I was well enough to do that. I didn't do anything that was going to cause me any harm. But those days were fairly brutal. I had the most incredible support from my team leader and from my senior team leader at work. But there was days that I would need to say, look, I've actually just been sick in between calls. I need to log off. I can't do this today. And they were amazing and so understanding with that. So the support network that I had, I'm very grateful for. But even though I had good support, I had a lovely family, great children, great friends, you know, to blow Craig's trumpet again, Craig, you know, we've got Josh and Erica as well in that. Lots of people on that journey with us. It was still awful. And for everyone that would appear to support you, there would be comments made, possibly well-meaning, possibly a little bit naively on other people's part, but that would throw me off par. So where I'm trying to be strong and keeping going, and I ended up with this term of I need to let myself off the hook. This was post-transplant. So during the run-up to transplant, it was very much just keep going, just keep going, just keep going. If I need to go to bed at 6 o'clock, I'll go to bed at 6 o'clock, but I'm getting up and I'm going to work the next day and I'm going to succeed at work. I'm not going to be a liability to my employers because I may as well go off sick. The nature of my job is that we're audited. You've got to be good at what you do. And I never once failed an audit. I succeeded well at that. But post-transplant, when my body had then not got to fight anymore, it was almost like I stopped being able to fight, to keep going. And there's lots of reasons for that. You're on a high level of medication, you're on a steroid, you're on huge amounts of very new drugs, lots of which have side effects. But they're great because they keep your kidney safe, and that's what they're there for. And the importance of those. But the combination, I think, of the trauma that I'd probably suffered over the 4 years of being poorly, post-op, all of that goes on, the world that you've been thrown into, and then finding out who I was again, because I'd lost who I was. And I'm quite headstrong. I'm quite forthright. I love people. I love being loved. But I can put up a good fight. And it was almost like, I just don't know who I am. I don't know how I'm meant to live this new life I've got. I don't know how to honour the gift that I've been given in a world that I don't really know anymore. And what I would say is, I'm very aware, to use the COVID word is a bit of a dodgy word for lots of people for lots of reasons, because there's so much emotion and opinions and everything that goes with that. So I'm going to be cautious saying the COVID times, but those times that we were thrown into a world of chaos, however you view that. For me personally, I just called it COVID, and I didn't have a challenge with it, but I'm being cautious. So during that kind of period from March 2020, people then came back out the other side of lockdown and restrictions. I never came back out because I had kidney failure waiting a transplant. So while everybody else came out, who perhaps wasn't poorly, because I'm aware, lots of people listening to this will completely understand, we didn't come back out. We were shielding, we were cautious, we were mask wearing, all of these things that we did to keep ourselves safe the best we could. And when we then had my transplant, I didn't know what to do because we'd never come back out. We were still mask wearing, we weren't going to shops. And it took a long time to come to terms with, how do I do that now safely? Because you've got a kidney, but it comes with challenges of being immunosuppressed. And how do I do that I live this amazing life that I'm dreaming of? And it was little by little. It was taking the pressure off of, I must do this, I've got to do that. Must do, should do, could do. All of that was in my head constantly. And it was nobody's voice other than my own. There was no pressure elsewhere. Perhaps sometimes some silly comments, maybe thoughtless, maybe just naive from people. And I then had to go on a wee journey of finding out who I was again and picking up on things slowly by slowly, little by little, and having the right people around me in those moments who understood and got me for who I was. And now, we're 2.5 years down the line, I go to big concerts, that I go to 15,000-seater concerts. I go to the cinema. I don't really go to the shops because I don't really enjoy them, to be fair. So I tend to shop online because it's far more convenient for meal planning. But I do all of these things really safely and in a way that works for me. So for other people who have had a transplant or are living through kidney disease and on dialysis or in the early stages of being diagnosed, you live life the way it works for you is what I'd say. But don't not listen to that wee voice that says, actually, I need some help, because I needed some help. And I kind of knew I just needed somebody to talk to out with the norm. And I had the most amazing support through Kidney Care UK counselling service. And it was just a voice that I could be me with, who understood exactly why I felt the way I did. And one of the things my dear counsellor said to me was, it's almost like you've been out in a boat at sea and you've been tossed about in the waves, in the storm, but you're safe now. You're at shore and you're safe. And I am safe, and I'll continue to be safe. I don't know what the journey looks like in the future. None of us do. But I live by the day, and I live my days being, this is the opportunity. I get up in the morning, I think, this is the day I've got today, and I'm going to live it, and I'm going to live it well. And the things that we do safely. We do very wisely, as we need to. But I live life really well. But that support and knowing that I had that it was okay to have some challenges post-transplant, to have a moment of my brain trying to catch up with just what happened. And one of the, again, a lasting moment for me was morning after my transplant, my surgeon came in to see me. I'm not going to name names here because, if I did, I'd have to name everybody. But I will say Queen Elizabeth University Hospital in Glasgow, if you've even walked through the door, I love you. If you've been in a theatre with me, thank you. Anybody who knows my name, from the fella who used to come in and clean my room to the surgeons who have operated on me, I will be forever grateful and continue to be, because the team that I've had, and there's been a couple of surgeries post-op just to tidy things up, incisional hernia, all of these things that happen quite often. But my surgeon the morning after my transplant came in, and a lovely, lovely, lovely person. And she said to me, you look amazing. And she explained, that obviously the drugs had kicked in and all of that. And, next day she came in and I was crying before she walked through the door. I said, oh, it's day 2. That's completely normal. Don't worry about it. Just have a sleep. But the reassurance and the care and the continued care has meant the world, because these people know it back to front and inside out. They do it every day. But when it's new to you, it feels like too much and quite overwhelming. And with that, for me, came a little bit of anxiety or overwhelmingness of, there's too many people around me, they are too close to me. And I've learned now just to control my own space and walk away, just be like, I'm so sorry, I'm just going to take myself out. The only thing you can't do that in is an airplane, but it doesn't stop me going to Spain on holiday. So that's what I would say in summary of, doing the journey. It all sounds very lovely. You have this idyllic, you don't have hemodialysis, you've got a fistula made, which was a super fistula, but was never used, thankfully. And it all looks on paper really quite something. If you look at my journey, you think, wow, I'd like that journey. But it doesn't come without its challenges. But it's how you do that journey, I think, and how you do it for you.
And what has helped you personally with the challenges?
The love of a good husband. For me, if you haven't got someone a Mr. or a Mrs., that's okay. Find a somebody though, somewhere. It could be somebody in your local shop that you go in to buy your bread and milk. Just find somebody who you can share heart with and be yourself. And if you feel you haven't got that, somebody, reach out to Kidney Care UK. They will help you. So that for me was my support and my friends. And you know who you are, the constants in my world. And there's few of them, but they've been constant. And I would say that along with my faith as a Christian, Josh is also a Christian, and, you know, to share his part of it was very much that he did it and gave me his kidney because Josh is very profound in his faith and just said that, you know, all he was giving me was one of his kidneys. But that in itself has changed my life and saved my life. And, you know, from a physical point of view for the time being, we don't know what that journey looks like, but we'll take it as it is just now and today. But for me, I would say my faith and knowing that I had a hope out with. And again, on the outside, you know, I would walk into a clinic appointment, you know, bold, well-spoken, happy, and I'd walk out of it in tears because somebody had shown me a kindness or said, Lois, how are you really? I'd be like, I don't know what I'm doing. You know, it was that. And I think just having the support and being honest, that's what got me through. But my firm foundation, I would say, is my faith and my church family as well. They've been phenomenal too of supporting me and supporting us and doing the journey with us.
So I know that you shared your story as part of the Kidney Care UK's Bloody Amazing Kidneys campaign and were actually featured on TV. Could you tell us about that?
Yes, so that was so good to be part of that campaign, and we were so chuffed to be asked to do it. Josh and I were interviewed by Scottish Television's news programme, and we featured on their evening news an interview with us all about Bloody Amazing Kidney campaign for Kidney Care UK, along with a little bit of our story about the transplant.
And as always, I will put the links to this in the description box so you can check out Lois and Josh's interview. So today, Lois, you shared your Kidney Warrior story, your journey with CKD, from your childhood diagnosis of PKD to the decline of your kidney function as an adult, to receiving that life-saving, life-changing donation from your superhero, Josh. You've shared about the highs, the lows, and everything in between. What is your final word of encouragement for the listeners?
So keep being you. Do your journey how you need to do your journey. Don't think of yourself as better. Don't think of yourself as worse than somebody else. Just do it the way you need to do it. Trust your team. Trust the support that you've got there. Reach out where you can reach out for help when you need it. And just be you. And all of it be you. Find the small things that you can do in a day, even on a difficult, brutal day. Find a small thing that you can think, I did that. Go to bed at night and think, I managed that. It could be something really simple, and just keep hope and keep faith that things will get better and that things will change.
Thank you so much for joining me. Thank you so much for sharing your story. Thank you for the advice and the encouragement that you shared. I know that your story will help so many people. So thank you so much.
Thank you so much for having me. I've been so pleased to be with you today. And thanks to you for listening.
Thank you for listening to Diary of a Kidney Warrior podcast. I truly appreciate your support. New episodes of this podcast are released every other Monday, so make sure you subscribe so you don't miss future episodes. And if you found this episode helpful, why not share it with someone who might benefit too? To stay up to date with the latest episodes, news and resources, sign up for the email mailing list and join the WhatsApp channel. All the details are in the episode description. Until next time, take care and choose to live.